Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Is my voice coming to everyone? Hello, good evening. आज बहुत अच्छा टॉपिक है. Today is a very beautiful topic. Today's topic of choice is nothing but our what you called nephrotic syndrome. It is a very nice topic. बहुत अच्छे से मैंने पढ़ा हुआ है. हाँ जी. Is my voice coming? Yes or no? Please put a message in the comment section. Thank you very much. Hi Swaraj, Suman. Good evening. कैसे हो? आवाज़ आ रही है कि नहीं आ रही? This is the beautiful Unacademy NEET PG platform. And today we're going to talk about some amazing stuff regarding nephrotic syndrome. Nephrotic syndrome is a final year MBBS topic. It is a internship topic, and also at the same time, we have multiple questions from the nephrotic syndrome for the upcoming exams also. So, is my voice coming? Yes, I think it's coming. Okay, cool. 1 second, I'll just adjust my this thing. Okay, great. Perfect. Hi Shagufta. Hi Shagufta Parveen. Hi Swaraj. So this is the Unacademy NEET PG platform. My name is Dr. Anand. And yes, most importantly, let's start the amazing segment. Let me check. Yeah, perfect. So my name is Dr. Anand, and first of all, in the what you call beautiful Unacademy NEET PG platform, we have something known as this free test calendar. I recommend every one of us to participate in as much as possible in this free test calendar, guys. It's amazing. Like, participate in all the videos, they are really good. At the same time, we have this beautiful new introduction to our amazing Unacademy, something Unacademy Lite for the NEET PG. Very light syllabus with a very nice to the point MCQs and grand test we have in this one NEET PG test series. Subject wise, of the all 19 subjects, full length mock test, previous year question paper, test series, and grand test. Like, everything is important for NEET PG, INI, CT, and FMG. So it's known as Unacademy Lite. नया introduce आया है ये. And also we have a test, 40 questions, 60 minutes. March 20, we have a CVS ka test, cardiovascular system test is there on the March 20th. So guys, if you're free, then please join the test. Also at the same time, in the Unacademy, we have something known as Plus subscription, where the educators are really good. The quiz is really like to the point. The MCQs are amazing, and the classes are live as well as recorded. In the Iconic subscription, what do you get? You get the Unacademy platform, and the Prep Ladder subscription. You get all the video lectures, full syllabus, MCQs, dream notes, quiz, everything on the Iconic subscription. Okay, so that's it. And also, last day, today is the last day for this beautiful mind-blowing Unlock 20. Save more for few more days. Prices rise soon. Get 20% off on all the Unacademy subscriptions before 12 o'clock midnight tonight. From tomorrow, we won't get this coupon code, and if you want to use the code is Dr. Anand. You can use it. You will get 20% off. The exam is very, very near. If you were planning to finish your syllabus, finish it and clear it off. Okay, फिर बार बार क्या ही लेना. ठीक है. Also at the same time, congratulations to the students who worked so hard, and these FMG students have nailed it, and now it is your turn to nail the exam. बहुत अच्छे से मोती की तरह हम सारी चीज़ों को पढ़ रहे हैं. I hope you guys are kind of trying your best, and we have students Osama Sheikh, Hari Mohan, Priyanka, Vaid, Hisha Gupta, so many people who are trying so best. So I want you also to try. If you're new to this platform, then please download Unacademy app, where we have this beautiful, mind-blowing, amazing features, like you can ask any doubt anytime. You never miss the classes because all the lectures are recorded, and you get a PDF file of every note. So it's amazing. Also, this batch, we have this revision batch for the NEET PG students. This is very good. And also we have FMG bilkul nazdeek hai. So we have March 16 to May 16th, we have this FMG batch, and that's it. And this is the last slide showing you about the beautiful NEET PG subscription. As I told you, we have something known as Plus subscription, Iconic subscription, and this is the Light subscription. Light feel light feel करें, light रहें और life को enjoy भी करें. So amazing plans. I mean, it's very nice. That's it. Let's start the beautiful segment, and today's topic of choice is nephrology part 2. In the part 1, we have covered urinary tract infection in depth and detail, and today we're gonna talk about nephrotic syndrome. Nephrotic syndrome we're gonna talk about in a very beautiful way, and it's gonna be a good class. So, but all I want from you is that try to participate as much as possible, because the more you participate, you will get a very good vision कि nephrotic का बच्चा आता कैसे है, how does it will it present, right? So let's start the class, and before starting any any classes, we always have a motivating quote. One quote in the beginning, one quote in the end, and if you feel sleepy in the in between, then we'll put another quote also. All you have to have is show me good vibes, good vibes, good vibes, good vibes. मैं ज़िंदगी में इतनी मेहनत कर रहा हूँ, मैं चाहता हूँ आप लोग भी उतनी मेहनत करें और अपने सारे सपनों को पूरा करें, और it's gonna be beautiful, I'm telling you. Maybe it looks hard right now, it looks very difficult to clear an exam sometimes, but you will, you can do it. कोशिश तो करो, हो जाएगा. अपने आप को बोलो हो जाएगा. कोशिश तो करो ना, है ना. कोशिश बहुत ज़रूरी है, right? Yes, very good. So let's start, and always remember, before starting this amazing segment, we always have a motivating quote, and this quote says, growth is a continuous process. Growth is a continuous process. Keep learning and keep growing. So it's a very beautiful quote. Growth is a continuous process. Every day in our classes, we are learning, 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 revising, learning. डांट खाते हैं, मार खाते हैं, फिर लर्न करते हैं. मेरे से चार गालियां सुनते हो, फिर प्यार करता हूँ, फिर लर्न करते हैं. मैं निंदा करता हूँ, फिर प्यार करता हूँ, फिर लर्न करते हैं. Are you understanding? Yes or no? So we all are one family, guys, and every day we are learning, learning, and learning. Don't, okay. Nimi says, please, English, sir. Okay, I will speak in English. Do you want to hear some English song? I don't know English song. I only know Hindi songs. Anji, so yes, okay, I'll speak in English, dear. So remember, my dear friends, growth is a continuous process. Keep learning and keep growing. Never have this attitude that you know everything and you have revised and you know everything. No, learning has no age. Every day we learn. Our parents are learning. My doggy is learning. I am learning. Everyone is learning nicely. So growth is the continuous process. Keep learning and keep growing. Right? Yes. Today's topic of choice is this one. What is this Rajma Chawal doing here? What is this? What? Who will tell me? What is this Q2 Q2? मुझे बड़ा अच्छा लगा. I love this picture. It's very nice. We can finish the whole 1 hour topic on this slide only. हाँ जी. So what is this? Can anyone tell me? Osama, क्या है ये? What is this? तुम्हारा दिल है ये? Is this your heart? I don't think so. Heart looks like this, sir. What is this? This is my kidney. Yay! This is my cutie pie kidney. And we're gonna talk about something about kidney today, something about very beautiful things, what my kidney does, and how I will get nephrotic syndrome, what are the clinical features, investigations, and management. Anna, are you getting it? Yes, beautiful. Chalo, and always remember, see, how the question is going to come, how the question is going to come. We all know that we're going to study nephrotic syndrome today, but examiner do not like to directly take you to the topic itself. Examiner will always start with the MCQ. The examiner starts with the MCQ. The MCQ of the choice is, a 5-year-old child, a 5-year-old child came with complaints of swelling over the body, swelling of the body. How do you approach this case? Please, my dear friends, I want you to use your brains. Talk to me, comment, discuss, whatever you feel. Okay, that you should know. Yes, exactly. Yes. Osama has a very beautiful line. He says, each kidney formed by 1 million nephrons. Yes, the each kidney is formed by 1 million nephrons. Yes, Dr. Saab, you're very, very right. So yes, a 5-year-old boy came with complaints of anasarca. Anasarca. What is anasarca, sir? Anasarca is nothing but generalized body swelling. Generalized. There's a swelling over the face, over the body, over the thorax, abdomen, genitals, legs, and even full body. Right? So, how do you approach this case? How do you approach this case, anyone? What are the differential diagnoses? What are the differential diagnoses of anasarca? Now, who will tell me? If I am the examiner, you're giving the next exam, and I'm asking you, this 5-year-old boy came with full body swelling. What are your thoughts behind this? What are the differential diagnosis? If I talk about anyone, what are the differential diagnosis? Hari Mohan Chaudhary, Swaraj, Julie. Yes, दादी नहीं किया, दाढ़ी नहीं किया सर. दाढ़ी रात को करूंगा अभी क्लास के बाद. टाइम ही नहीं मिला, जिम से आया हूँ अभी, टाइम ही नहीं मिला. Yeah. So anyone? Very beautiful, very beautiful. Ansha Gupta says, okay, nephrotic syndrome. Yeah, I agree with you. See, my HOD used to say, whenever someone asks you differentials, go system wise. Go system wise, yes or no? In the cardiac causes of anasarca, can we think of congestive cardiac failure? Number one. In the hepatic causes for the anasarca, can we think of portal hypertension? Yes or no? In the kidney causes of the anasarca, can we think of nephrotic syndrome? Yes, very true. In general, also in a case of severe anemia, anemia, anyone baby having hemoglobin only 4 gram per dl. So anemia means hypoproteinemia. Like, and if I have anemia, everything will be low, right? My albumin, my globulin, my proteins. So anemia leading to hypoproteinemia leading to anasarca, right? So that's what. So yes, exactly. That's how you have to, what do you call it? ठीक है. Okay, Julie, I'll check that. No problem, dear. So that's what. That's how you will say in system wise. The differential diagnosis of anasarca. See, always I tell you one thing, okay, very frankly, if the examiner knows that you have read and come nephrotic syndrome, so everyone will jump and nephrotic, anasarca, nephrotic. Examiner does not want to know that. I remember I had this case presentation in my third year MD exam. I got a short case of nephrotic syndrome. For 45 minutes, my patient was this only case, 5-year-old child with full body anasarca. The short case went for 45 minutes. An examiner did not even ask me a single question on nephrotic syndrome. He's like, baby have anasarca. No, why are you jumping towards nephrotic? Anemia cannot cause anasarca. Portal hypertension cannot cause anasarca. Congestive cardiac failure cannot cause anasarca. Yes or no? It can cause, right? So my आधा घंटा पौना घंटा examiner was only asking me about everything except nephrotic syndrome. So this also tragedy can happen with you also. Okay, so you should read everything. The differential diagnosis of anasarca are anemia, malnutrition. Sam, yes, have you heard of SAM, severe acute malnutrition? Have you heard of kwashiorkor? And have you heard of marasmus? Yes or no? Which one will be the skinny baby? Marasmus baby will be the skinny baby, sukha bacha. How do you know, sir? S for marasmus and S for skinny baby. And kwashiorkor will be the fatty baby. So differential diagnosis of anasarca are, see, you should be a good doctor, okay? Good doctor will think in every aspect, not just NSRK, only nephrotic. Anemia, malnutrition, congestive cardiac failure, so important. Nephrotic syndrome, renal cause, portal hypertension, hepatic cause. At least this much, these 5 differential roughly should come to my mind. And then slowly you should take the case towards nephrotic syndrome. So question number 1, I think everyone knows about it. Nephrotic syndrome is characterized by what? Now who will tell me? Nephrotic syndrome is characterized by what? What all are the important highlighters for nephrotic syndrome? Who will tell me? Yes, exactly. Very beautiful. Shagufta, Harimohan, and Julian, Vikas, and Swaraj, and Osama. Yes, nephrotic syndrome is characterized by hypoalbuminemia. Number 1, hypoalbuminemia. So PG entrance question number 1. See, I'm telling you the PG questions back to back with the slides only. What is the cutoff for hypoalbuminemia? Who will tell me? Albumin, what is the normal albumin and what is the cutoff of the hypoalbuminemia? Kitna hona chahiye? Less than what? Less than what? Anyone? Yasha Gupta says massive proteinuria. Yeah, we see massive proteinuria. Hypoalbuminemia. Kitna cutoff? Less than 2.5 gram per dl. That's very important, guys. Please remember, nephrotic syndrome is characterized by 4 points. Number 1, hypoalbuminemia. Number 2, hyperlipidemia. One by one we will understand why there is hypolipidemia and this and that. So hyperlipidemia, serum means hyperlipidemia matlab serum cholesterol is high, right? What is the cutoff of serum cholesterol? Who will tell me? Kitna? More than what? More than what? Anyone? Yeah, very good. We have Ganesh. So beautiful. The more you try to participate in the slide, no, I'm frankly telling you, you will get a seat. You will never forget. You will never forget the concept and the topic because you participated. You will remember more, right? गलती है चलेगी, 2-4 सुनाऊंगा अच्छे से मैं, लेकिन प्यार भी उसके बाद करूंगा. Exactly. Anu Thakur has so good. Julie says less than 200. Less than 200. शादी में आई हो तुम. हाइपर लिपिडीमिया, हाइपो नहीं बोला मैंने. सो मोर देन 200 mg per dl, राइट? सो कैन वी रिवाइज प्लीज? नेफ्रोटिक सिंड्रोम इज कैरेक्टराइज्ड बाय हाइपोएल्ब्यूमिnemia, hyperlipidemia, proteinuria. Now this is such an important part, guys. So what do you think, my friends? Proteinuria, do you see like which proteinuria? Do you see mild to moderate proteinuria or do you see massive proteinuria in a case of nephrotic syndrome? I think as everyone knows, Anu Thakur has already told
Yeah, usually 3.5 to 5. The norm albumin levels NIMI is roughly 3.5 to 5. That's what. And cutoff is less than 2.5. We will say it's hypoalbuminemia in nephrotic. Yeah, you get massive. Yes, massive means kitna? What massive? More than what? Can anyone tell me? Can anyone have a random guess? Massive proteinuria means proteinuria. You can say 3 plus or 4 plus, of course. And in gram per DL, if I want to mention, then how much I should say massive proteinuria? So you will say more than 1 gram per meter square per day. More than 1 gram per meter square per day. That is nothing but massive proteinuria. Or massive proteinuria means urine protein 3 plus or 4 plus. Urine proteins, please understand the concept. You take my urine sample and check the protein content in my urine. I have protein urea in my urine. There is protein, massive, too much of proteins are there. So too much of protein, either you can say as 3 plus and 4 plus, and or you can say more than 1 gram per meter square per day. ये दोनों चीजें याद रखनी है. These two things you have to remember. Okay. Exactly. Yeah, we have someone who said an extra point. Yes, exactly. Do you see normally proteins in your urine? See, listen, everyone, these values are important. These values are important. I'll tell you another values also. The cutoff for hypoalbuminemia in nephrotic is less than 2.5. The cutoff for hyperlipidemia is more than 200 milligram per DL. Okay. And the cutoff for massive proteinuria is either you say 3 plus or 4 plus. 3 plus and 4 plus, you say how? You say by heat coagulation test. Have you heard of heat coagulation test? One by one, in depth and detail, I'll be telling you what is heat coagulation test, how do you take the slide, how much urine do you add, which part of the slide you heat. Every single part of biochemistry also will do the integrated with the pediatrics. Okay, so you will see massive proteinuria. Massive matlab how much massive? Sir, either you can say 3 plus or 4 plus. And how will you tell me it is 3 plus or 4 plus? Sir, you will heat my urine. You will take my urine sample in a test tube. You will heat my test tube and you will see the cloudiness. You will see the cloudiness. Are you understanding what I'm trying to tell you? These are important words, okay? And we'll have pictures also later in the further slides. Okay, what is cloudiness? How does it look like and all that? You'll get an idea. Okay, perfect. Yes. So do you see proteinuria? Question number one. See, go, take it very light. Do you see proteinuria in nephrotic syndrome? Yes. Which one? Massive proteinuria? Yeah, sir. Massive. Too much of proteinuria. Too much of proteins in my urine. What is the cutoff? Sir, either you can say 3 plus or 4 plus, or you can say more than 1 gram per meter square per day. That is the two questions. Question number 3. Do you see normally proteins in my urine? What do you think? Yes or no? Please, it's a live discussion. It's an open table discussion. Talk to me. पार्टिसिपेट ट्राई टू आंसर. गलती ही होगी ना, दो चार सुनाऊंगा अच्छे से मैं, और फिर उसके बाद मैं आंसर बता दूंगा. हम्म. तो ओसामा ब्रो, चेस्ट मारी है, दर्द हो रही है चेस्ट में. हम्म. क्या? Okay, so remember one thing. Do you see normally proteins in my urine? The answer is yes. Normally, understand the concept, okay? Normally in your urine, my urine, everyone's urine, protein is present. We see proteins in our urine. How much, sir? What is the cutoff? Remember, less than 4 milligram per meter square per hour. The normal protein urea is nothing but less than 4 milligram per meter square per hour. In my urine, normally I can see proteins, and sir, what is the cutoff? Less than 4 milligram per meter square per hour. Okay? Then it is divided into nephrotic range proteinuria, nephrotic range proteinuria. These are very important words, dear. Please remember. Are you feeling sleepy? Anyone feeling sleepy? I have an idea. Take a bucket of water, drown your head inside the bucket of water, and then will you feel sleepy? No, no. No. Do like that. You'll feel better. Okay. So remember, what is this? What are we studying? Sir, you are teaching something known as nephrotic range proteinuria and something known as non-nephrotic range proteinuria. No, nephrotic range proteinuria. See, normal proteinuria, non-nephrotic range proteinuria, and nephrotic range proteinuria. If my proteins in my urine are less than 4 milligram per meter square per hour, that is normal proteinuria. 4 to 40 milligram per meter square per hour, that is non-nephrotic range proteinuria. And more than 40 milligram per meter square per hour is nephrotic range proteinuria. This is very, very, very Important. Less than 4, 4 to 40, more than 40. Are you understanding, dear? Less than 4, 4 to 40, more than 40. Less than 4 milligram per meter square per hour is normal proteinuria. 4 to 40 milligram, I got a burp. 4 to 40 milligram per meter square per hour is क्या बोलते हैं, नॉन नेफ्रोटिक रेंज प्रोटीन यूरिया, राइट. एंड मोर देन 40 milligram per meter square per hour is nothing but nephrotic range protein urea. ठीक है, these are three are very 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 important. ठीक है, done, finish. Next question. Yeah, so I think it's over. Nephrotic syndrome is characterized by hypoalbuminemia, hyperlipidemia, massive proteinuria, and edema. Bilateral pitting type of pedal edema. This is the first very important basics 5 marks MBBS final year question. And anyhow, 23rd and 24th March we have final year MBBS exams also in our hospital, and the external will come from maybe from RML or Safdarjung. वहाँ दोबारा पूछेंगे, विल हैव अ शॉर्ट केस ऑन नेफ्रोटिक सिंड्रोम. वहाँ मैं तो पक्का पूछने वाला हूँ टू द स्टूडेंट्स दैट व्हाट इज द nephrotic syndrome is characterized by what exactly. So Anu says, sir, hypertension may cause no dear, usually hypertension is a part of nephritic syndrome. Normally you do not see hypertension in nephrotic. Hypertension is an important feature of nephritic syndrome. Okay, that's, yeah, exactly. Okay, Julie says, sir, A class brain tumor और malignancy का भी ले लो. मैंने मेडुलोब्लास्टोमा का ब्रो क्लास तो लिया है एक, ठीक है, मैं मुझे याद रहना, ठीक है. Exactly. Which of the 4 features is most important? This is important. That's it. More, most, less important. No, the book says these 4 are the features. That's it. Now, why edema? Can anyone help me out? Why there is edema? Please open your mind, think, discuss. Edema. I told you, right? Enasarca, right? Full blown swelling. Why? Why do you see edema in a case of nephrotic syndrome? I think everyone knows about it. Most importantly, hypoalbuminemia. Hypoalbuminemia is the most commonest cause for the edema. Why? Because what does albumin does? See, albumin has a capacity to retain the water inside the cell. Albumin has the capacity to retain the water inside the cell. So hypoalbuminemia, when there is decreased serum albumin levels, then that water retaining capacity decreases. So water goes out of the cells, basically known as increased capillary permeability. Like, this is the same pathophysiology happens in any severe anemia. This is the same pathophysiology happens in dengue fever. Do you know, right? Dengue fever also there is increased capillary permeability. So that is very important. So in general you should know, in a simple layman words, I'm telling, high five words I'm not using. There will be decrease oncotic pressure and this and that, but in general albumin has a capacity to retain the water inside the cell. Decrease albumin means the water retaining capacity inside the cell decreases, leading to full water outside. It goes out of the cells, nothing but leading to anasarca, full blown swelling. So yes, edema is because of due to hypoalbuminemia, and there is a decrease oncotic pressure, and that only leads to edema. And also at the same time, if there is decreased hypoalbuminemia and fall in oncotic pressure, it will stimulate the RAS. What is RAS? Renin angiotensinogen aldosterone system, right? I hope everyone knows about it. Yes, I'll repeat again. Do you see edema in nephrotic syndrome? Hanji sir, we see edema in nephrotic syndrome. Why do you see edema in nephrotic syndrome? Sir, basically because of hypoalbuminemia. Sir, serum albumin levels is low. Okay, then question is, if serum albumin level is low, why will you see edema? Sir, albumin, basically wherever the albumin is, water will stay there. So albumin has a capacity to retain the water inside the cell. So no albumin means water retaining capacity gone. So water moves out, increase capillary permeability in all the extra spaces, this interstitial spaces, the water goes and there is a full blown edema, and that will stimulate the RAS, that is renin angiotensinogen aldosterone system. वो क्या कराता है? एक ही बहुत इंपॉर्टेंट चीज कराता है, sodium water retention. It causes sodium and water retention, right? That leads to edema. So that's what water retention. Okay, so this is what happens in a case of nephrotic syndrome, edema, pathophysiology. Next important question, I told you why there is hyperlipidemia. Where the lipids are formed, who will tell me why there is hyperlipidemia? In general, why the serum cholesterol is more than 200 in a case of what you called nephrotic syndrome? Any random guesses? Exactly. So yes, exactly. Very good, very good. So why there is what you called yeah, very nicely you're answering. So the cholesterol level basically will be high because of this when there is hypoalbuminemia, no. Hypoalbuminemia, it induces the hepatic synthesis of beta lipoprotein. When albumin kahan hota hai? Albumin, globulin, all those things are there in the liver, right? So when albumin is low, it will tell the liver to make more albumin naturally. Hypoalbuminemia induces the hepatic synthesis. So with the albumin, the liver is making lipoproteins also. Hypoalbuminemia will induce the hepatic synthesis of the beta lipoproteins. समझ में आ रहा है ना? So that is the cause basically leading to hyperlipidemia. I'll repeat again. Whenever there is hypoalbuminemia, what happens? When the albumin is low, like liver basically helps in formation of all these proteins, albumin, globulin, and everything. So when there is hypoalbuminemia, I will tell my liver to make more and more albumin. So liver basically, with side by side of making more albumin, the liver is making more and more lipoproteins also. Nothing but fat, nothing but cholesterol, leading to hyperlipidemia. That you should know, right? Exactly. Yeah. Now PG entrance question number 5. PG entrance question number 5, which is the most commonest cause, which is the most commonest cause of nephrotic syndrome. What do you think? Which is the most commonest cause of nephrotic syndrome? Which is the most commonest cause? Yes, very good, Vikas. Shagufta, Osama, Kamal, very good, Swaraj. Beautiful answer. The most commonest cause of nephrotic syndrome is I don't know. I don't know. I don't know. Okay, I don't care. I love it. वही बड़ा अच्छा गाना है मुझे बड़ा अच्छा लगता होगा ना yes yeah exactly the most commonest cause like 90% cause of nephrotic syndrome is primary causes. Please remember that this is important question. What are the causes of nephrotic syndrome? Primary causes and secondary causes. Primary causes 90% cases Nelson and OP Ghai 9th edition says that idiopathic भैया I don't know it happens it is unknown cause that's it unknown cause हो जाता है बस बात खत्म. प्यार है प्यार हो गया बस मुझे नहीं पता बस मुझे प्यार हो गया it's like this. So that's what the most commonest cause of nephrotic syndrome is nothing but idiopathic. I don't know. Okay, 90%. Now, what are the secondary causes? This was the question examiner had asked me. Everyone knows about minimal change nephrotic syndrome and all that. Yeah, exactly. What are the secondary causes? What are the secondary causes? Can anyone tell me any one secondary cause? Like I was suffering from dash, then I got nephrotic syndrome. I was suffering from dash, then I got nephrotic syndrome. So what are the secondary causes of nephrotic syndrome? Anyone? So hepatitis B can cause nephrotic syndrome. SLE, if I'm suffering from any, are you understanding? So most importantly, SLE, systemic lupus erythematosus, hepatitis B, amyloidosis, vasculitis, anything can cause nephrotic syndrome. Baba, remember? Yeah, very good. So this Priyanka is very right. Any infection, it is not just that idiopathic or minimal chain disease is the cause. Anything can cause nephrotic. ये बहुत important है. This is important. Okay, like no one knows about it usually. People don't even think that hepatitis B infection can cause me nephrotic. Definitely, any infection can flare up and can affect my kidney and can cause me nephrotic syndrome, right? So SLE, hepatitis B, amyloidosis, and vasculitis. These all are the important secondary causes of the nephrotic syndrome. Very good. Next important question. Yeah, now this is a very simple, smart question. 30 minutes are over, 30 minutes are left. We will try to cover as amazingly as possible. Okay, let's take a halt. Is everyone understanding what I am teaching? Yes or no? Please put a like button to this video or please give a heart or a golden heart or a black heart. Osama usually gives a white heart. So is everyone understanding? Yes or yes, yes. Okay. Okay, let's start. So yeah, so we were studying nephrotic syndrome. Let's have a very quick revision of nephrotic syndrome. Sir, nephrotic syndrome number one, you told me something about the differential diagnosis of NSRK. If the patient has come to me with a full-blown generalized swelling, I must think of anemia, SAM, kwashiorkor, congestive cardiac failure, nephrotic syndrome, portal hypertension, and multiple other causes. As the topic of choice is nephrotic syndrome, this cute little kidneys, I love it. So it is characterized by hypoalbuminemia, less than 2.5, hyperlipidemia, more than 200, proteinuria, which is usually of a massive proteinuria, massive, either you can say my urine protein is 3 plus or 4 plus. Urine protein matlab you take my urine sample, heat my urine sample, and then in my urine you will see proteins, massive proteinuria. No, so you will see 3 plus or 4 plus proteins, or you can say more than 1 gram per meter square per day. Then also we understood that do you see normally proteins in your urine? The answer is yes, I do see urine in my proteins. What is the cutoff? So less than 4 milligram per meter square per hour is the cutoff. 4 to 40 milligram per meter square per hour is non-nephrotic range proteinuria, and more than 40 milligram per meter square per hour is nephrotic range proteinuria. It's an exam question. Then that's it: hypoalbuminemia, hyperlipidemia, massive proteinuria, and edema. Then these simple things we understood. And the most commonest cause of nephrotic syndrome is primary cause, like the idiopathic. The book says idiopathic is usually the cause of nephrotic syndrome. Secondary could be SLE, hepatitis B, amyloidosis, vasculitis, or any infection in the body. Yes, what are the clinical features? Now, what are the clinical features of nephrotic syndrome? Anyone? What are the clinical features of full-blown nephrotic syndrome? Yes, exactly. So features of nephrotic syndrome mimics the features of congestive cardiac failure. Do you agree with me? Yes or no? Anasarca is there in congestive cardiac failure also, and anasarca is there in nephrotic syndrome also. So again, integrate and study. The clinical features of congestive cardiac failure are same as the clinical features of nephrotic syndrome. The features of congestive cardiac failure are divided into right heart failure and left heart failure. I'm writing it over here. We have right heart failure and we have left heart failure. Who will tell me what are the features of right heart failure? Osama, I'm having right heart failure, bro. Come help me. Osama, what do you think? Right heart fail. If my right heart is failing, Osama, what will you see? Anyone? Yes, Hari Mohan. Yes, the patient can have this distress. Anu Thakur. Anu Thakur is very beautifully. She's answering. Very good, Anu. My HOD always used to say, whenever you're explaining something, explain it from cephal to caudal or proximal to distal. So cephal to caudal, the points of right heart failure are: number one, periorbital swelling. Periorbital swelling, number one. Number two, facial puffiness. Can we appreciate facial puffiness? Periorbital swelling, facial puffiness. Raise JVP. What is JVP? Jugular venous pressure. So listen, okay, retain, like understand the concept, okay? Don't cram, don't cram. Anasarca, no, swelling. Swelling is easy, no? From top to bottom, the swellings are periorbital swelling, facial puffiness, raised jugular venous pressure, and very importantly, tender hepatomegaly. Tender. But tender hepatomegaly is a point of heart failure. Tender hepatomegaly you see in heart failure. In nephrotic syndrome, you see hepatomegaly. That much you can say, hepatomegaly can be seen in a case of nephrotic syndrome. And tender, where else do you see tender hepatomegaly? Can you tell me any one cause, just one extra cause of tender hepatomegaly? Osama, we have done this before, bro. Can you tell me? Rashmi, Julie, Harimohan Shagufta, and again Harimohan Chaudhary. What do you think? Tender, like touch करते मुझे लग गया. So tender hepatomegaly, where do you see? Yes, beautiful. Tender hepatomegaly you can see in amoebic liver abscess. Amoebic liver abscess. Amoebic liver abscess. Are you understanding? Yes or no? Please. Please, good vibes. Only positive vibes are allowed in this group. We all are one family, and only good vibes. Have a little smile on your face. Relax, chill. Just sit inside the topic. You are Lord Buddha. Sit inside the topic. Nephrotic syndrome. Swelling everywhere, swelling, periorbital swelling, facial puffiness, raised JVP, tender hepatomegaly, or just hepatomegaly you can say. Tender hepatomegaly is seen in congestive cardiac failure, and also it is seen in amoebic liver abscess also. Yeah, in cirrhosis also you can say tender hepatomegaly. What else? Features of right heart failure. Can you see ascites? Yes, definitely you can see ascites. Can you see okay, effusion? Hanji sir, you can see effusion. Can you see scrotal edema? Undoubtedly yes, you see scrotal edema. So scrotal edema you see, and very importantly last कौन सा था वो क्या बोलते हैं उसको, pitting type of pedal edema. Pitting type of pedal edema. Are you understanding? These all are the features of right heart failure, or also these are the clinical features of nephrotic syndrome. A patient can come to us. समझ में आ रहा है डियर? ब्रो आसामा तेरे को समझ में आ रहा है डियर? ठीक है, चलो अच्छी बात है. And then very importantly, scrotal edema. I'll give you a chocolate if you can tell me what are the three important conditions where you can say scrotal edema. You have to link and study, link and study. Hello, link and study. We are studying nephrotic doesn't mean we will stick nephrotic only. No, we will study everything in an integrated manner. That's how a topper does. तो यस क्या बोलते हैं उसको, हाँ जी, वेयर एल्स डू यू सी स्क्रोटल एडिमा? ब्यूटीफुल, शगुफ्ता सेज हाइड्रोसील, यस डियर, यहाँ जगह नहीं है मैं यहाँ लिख देता हूँ. सो या क्या था, स्क्रोटल एडिमा, यस स्क्रोटल एडिमा, और आई वुड से orchitis, right? Orchitis. I can see where else? You can see in kidney nephrotic syndrome. You can see in congestive cardiac failure, yes. Can you see in hydrocele? Undoubtedly yes. और एक और था ना, कौन सा कोई बता दे मुझे अच्छा सा एग्जांपल. एग्जैक्टली, ओसामा शेख इज राइट. मम्स very important. Mumps, measles, mumps, chickenpox. Mumps is caused by a bacteria or a virus. It is caused by a virus. Mumps patient, how it will present, how the mumps patient comes to us with bilateral parotid swelling or a unilateral parotid swelling. 80% cases the patient comes to you with unilateral swelling with little pain at the TM joint. What is TM joint? Temporomandibular joint. A 5-year-old child having some swelling over the right side while it pains while chewing gum, and yeah, this and that. Understood? Yes or no? So that's what. और क्या होता है, which is the most common complication of mumps? The most common complication of mumps, you can say, or yeah, the best complication of mumps is M for mumps, M for meningitis. The most common complication of mumps is meningitis, but a topper should say aseptic meningitis. And in older children, the most common complication of mumps is orchitis. It's important. Exactly, very good. So are you understanding? That's what. So again, come back to the topic. Nephrotic syndrome patient has clinical features, same like a congestive cardiac failure features, which is over periorbital swelling, facial puffiness, raised JVP, tender hepatomegaly, and tender hepatomegaly is seen in congestive cardiac failure, amoebic liver abscess, and some cases of cirrhosis also, but not generally nephrotic. Nephrotic, we see hepatomegaly, and then ascites. नीचे क्या पहले नहीं, effusion, lungs effusion, come down abdomen ascites, come down testis orchitis, come down body bilateral pitting type of pedal edema. Understood? These are the features of right heart failure. And left heart failure, the features of left heart failure in general. What are the features of left heart failure? The features of left heart failure are, can anyone tell me? Yes, Julie, आता हूँ अभी. मैनेजमेंट जूली बहुत आगे है, अभी तो थम जाओ तुम, बहुत कुछ बीच में आने वाला है. The features of left heart failure, I think everyone knows about it. Left heart is failing. Left heart कहाँ होता है? लेफ्ट हार्ट किधर? घुटने में नहीं, दिल में. So left atrium and left ventricle, right? Left heart is failing. If the left atrium is doing a back pressure, where the blood will go? It will go onto the pulmonary veins. Where the pulmonary veins are connected? It is connected in the lungs, right? So you will have crepitations in the chest. You will have additional sounds in the chest. The patient will have breathlessness. The patient will be very sick looking. So additional sounds in the chest, crepitations, or even rhonchi, and sick looking is the one. And yes, pulmonary edema, clinically, yeah, pulmonary edema also you can see. These were all the features of nephrotic syndrome or congestive cardiac failure. Next question. Nephrotic syndrome in a child is divided into two groups. Nephrotic syndrome in a child is divided into two groups. One is known as MCNS. What is MCNS? Can anyone tell me what is MCNS? MCNS is known as minimal change nephrotic syndrome. Minimal change nephrotic syndrome, which is very commonly seen. The most commonest type of nephrotic will be a minimal change nephrotic syndrome. What is the other name? I'll give you a chocolate if anyone can tell me. Osama bro, Julie, आगे आ जाओ. हाँ जी. What is the other name of minimal change nephrotic syndrome? कोई नाम गलती से कोई मुझे बता सकता है? Yes or no? Yes, the other name of minimal change nephrotic syndrome is steroid sensitive nephrotic syndrome. MCNS is also known as SSNS, मतलब steroid sensitive. Again, we have a perfect definitions of what is remission, what is relapse, what is steroid sensitive, or I would say steroid dependent nephrotic syndrome, and what is steroid resistant nephrotic syndrome. वो आगे आएगा. Are you understanding? Yes, exactly. Osama is right. So nephrotic syndrome, please have a good vibes and understand the concept. Nephrotic syndrome in children, it is divided into two groups. What are those two groups? Sir, one is minimal change nephrotic syndrome or steroid sensitive nephrotic syndrome. The other one is nephrotic syndrome with significant lesion. Nephrotic syndrome with significant lesion. Could be a post-streptococcal glomerulonephritis and all those weird names. वो सारे के सारे, ठीक है? So two are important, right? So minimal change nephrotic nephrotic syndrome, or also known as steroid sensitive nephrotic syndrome, and second one is nephrotic syndrome with significant lesion. Okay, number one. Number two, coming to the proper finding, this is one question they always ask in exam, like what is the finding in the electron microscopy in minimal change nephrotic syndrome? I think everyone knows about it. So anyone in the renal biopsy or in general electron microscopy में क्या मिलता है in minimal change nephrotic syndrome? Can anyone give a random or a wild guess कि क्या मिलता है? ये बहुत पुराना, it's a very old question. You see some effacement of something. You see anyone exactly. Shagupta has very beautiful told. You see, yeah, effacement of the food processes. Like this is the normal capillary in the minimal change. See, this is the normal capillary. This is the normal one. And here basically you see effacement. मतलब मैंने कहीं पढ़ा था, ओसामा याद रखना कि if the food processes are like this, no, there is a effacement. मतलब खुल जाते हैं ये food processes, तो सारा का सारा प्रोटीन्स यूरिन में चला जाता है. In a very layman word, I'm telling you, normally the glomerular or the kidney is like this, okay, but in minimal change nephrotic syndrome, this food processes effacement. They become open. In a very layman, I'm telling you, they become open, known as effacement of food processes. Once they become open, all the protein goes in my urine, all the proteins goes in my urine. That is why when there is effacement of the food processes, then what you call the whole proteins go in my urine, पूरा नीचे चला जाता है. So that you should know, effacement of the food processes. Yes, exactly. So coming to the basic treatment. Now, what is the treatment of nephrotic syndrome? What is the best answer you want to give? 5 more minutes, then this class is over. In today's class, I think we're going to study only about part 1 for the nephrotic syndrome, because in part 2 we need to talk about steroid sparing agents, levamisole, cyclophosphamide, tacrolimus, and this and that, doses, indications, contraindications. बहुत कुछ है आगे तक, पर वो बहुत आगे है, उससे पहले बहुत कुछ हमें पेंडिंग करना है. Exactly. Yes. So Kamal says steroid. Okay, beautiful answer. Shagufta says steroid. अच्छा, Julie says steroid. Pancake भी आ गई है घूमते फिरते steroid. So ऐसे नहीं आंसर करते. You should never answer like this. What is treatment? Treatment is divided into investigation and management. A topper must answer like this. Examiner, मैं बता रहा हूँ, बड़ा गुस्सा हो जाएगा. Examiner will get very angry if you say, sir, treat this as steroid, sir, steroid. अच्छा, steroid, very good. Come after 6 months. Steroid. Oh. So treatment is divided into investigation and management. So the first question of choice is, how do you, मैंने दिखा दिया, how do you investigate? How do you investigate a case of nephrotic syndrome? Anyone? How do you investigate a case of nephrotic syndrome? How do you start processing? A child who has come with full-blown anasarca, he has come to your busy OPD. How do you want to proceed this case? You are thinking of some renal pathology, then how do you want to proceed this case? Who will tell me that? अब तो वैसे एग्ज़ाम देना ही नहीं है, अब तो एमसीक्यू है. अच्छा, हाँ, हो एमसीक्यू है, लेकिन पता होना चाहिए डियर. आजकल यू नो ना, दे आर आस्किंग क्लिनिकल क्वेश्चंस नाउ. नाउ टू द पॉइंट क्वेश्चंस ना आके थोड़ा, a 5-year-old child came with busy OPD with the full blown NSRCA. How do you, which is the first investigation, which is the first best investigation would you like to do? So what will you answer? Yes, Shagufta, पहला आंसर किसने किया? The first answer has been given by Swaraj. So Swaraj has a very beautiful answer. See, open your brains, open your tiny half-gram brains. 550 वाला ग्राम का जो ब्रेन है, 250 ग्राम का ब्रेन है, उसको खोलिए थोड़ा सा. बहुत सही, ब्यूटीफुली यू गाइज आर आंसरिंग. नंबर 1, यू, अच्छा, सीधा अल्ट्रासाउंड. तो तुम्हारा करना है अल्ट्रासाउंड? नहीं, अल्ट्रासाउंड बहुत आगे है डियर. द फर्स्ट थिंग इज यूरिन रूटीन टेस्ट you will do, number 1. Okay, so remember one thing. Yeah, very good. Swaraj is right. You will do, remember guys, you will do a full body workup. Full body workup. See, for every slide I have a question. For every single slide there is a question. Question number 1. Why urine routine? मेरा मन नहीं कर रहा यूरिन रूटीन कराने का, तो आई डोंट फील लाइक गिविंग माय यूरिन सैंपल. सो व्हाई यूरिन रूटीन आर यू गेटिंग माय डन? गेट अ सीबीसी डन. नो, व्हाई यूरिन रूटीन? So the answer is, of course, sir, as we are dealing with a renal pathology, as we are suspecting NSRCA or massive proteinuria, so I would like to do a urine routine examination and would like to see the proteins, right? 2 plus, 3 plus, 4 plus, nil, trace. So what है ना, तो urine routine is important. Doctor, why are you doing full body workup, full blood workup? No, I'm a 5-year-old child. Do you want to take blood sample of mine? Why are you taking? Who will you answer? Anyone? Osama, Rashmi, what do you called? Atiyar Hussain. सर मैंने फर्स्ट आंसर दिया. ओके सॉरी बडी. सो बहुत ही प्यारा हमारे स्टूडेंट ने आंसर किया है. बहुत ही प्यारा नाम है अतियार हुसैन. सो मतलब क्या होता है ब्रो अतियार का? मैं सही प्रोनाउंस कर रहा हूँ ना? एम आई प्रोनाउंसिंग राइट ब्रो? अतियार बड़ा अच्छा सा नाम है. ओसामा अच्छा नाम है ना ये? अतियार है ना? एंड दिस मैंने आई सी पाकिस्तानी सीरियल्स. वहाँ पे एक था नेहमत. नेहमत इज ऑल्सो नाइस नेम. आई लाइक दिस नेम नेहमत. And this and I recommend you guys, the Pakistani serials are really good. Like one of my favorite is Humsafar. Humsafar is very nice. And as I told Pancake also, and she has not seen even once, Zindagi Gulzar Hai. Has anyone of you seen Zindagi Gulzar Hai? Anyone? Zindagi Gulzar Hai देखा किसी ने? Has everyone? Please raise your hands if you have seen Zindagi Gulzar Hai. It's a very nice serial. I like it. Humsafar is more of a melodramatic love couple scene, but it's a good, nicely made. But Zindagi Gulzar Hai, this is ultimate. It's like a girl who struggles from her life, and she is belongs to a very poor, like there are two families. One is a very rich family, one is a very poor family. So we have Fawad Khan in that, who is from a rich family, and some girl is there. Her name is Sanam Saeed. She's a Pakistani actress, Sanam Saeed. So she's very good also. So she's very tall and very nice. So Sanam Saeed is from a very middle class, very lower middle class background, and Fawad Khan is from a very higher background. And how she struggles and work hard and take tuitions, like it's like your and my story, you know. It's like your and my story. Very nicely made. You must watch it. It was there on Netflix, पर वो Netflix वालों ने भी वहाँ से उठा दिया है. And Pancake has the link. Is anyone, if anyone wants, Pancake has the link. Pancake please, जिसको चाहिए उसको link share कर देना, ठीक है? हाँ जी, exactly. Yes, perfect. So let's do. Okay, doctor, my question is, why do you want to do full body workup? See, the answer is why? Because you know that, like infection, the secondary causes. What are the secondary causes of nephrotic syndrome? Hepatitis. If I have hepatitis B, can I have nephrotic syndrome? Yes. If I have any vasculitis, Kawasaki, giant cell, Takayasu, this and that, can I have nephrotic syndrome? Yes. If I have SLE, butterfly malar rash, and a dsDNA positive, double strength deoxyribonucleic acid positive, can I have nephrotic? Yes. So that's what you will get. My CBC done, liver function test, kidney function test, urine culture, chest x-ray. Why are you getting my chest x-ray done, doctor? Why are you getting my chest x-ray done? You never know if I have TB. Yes or no? If I have a TB, can you start steroids if I'm suffering from tuberculosis? Yes or no? Do you start steroids if I'm suffering from tuberculosis? I have infection. No, infection can happen in anywhere, right? So if I have tuberculosis, will you start steroids to me? The big answer is no. See, this my HOD told in my MD time. He's a very good person. My HOD name was Dr. Utkarsh. Dr. Utkarsh, and I remember he told me in the second year of my MD that nephrotic syndrome patient, remember, to you also guys, you also will become MD medicine also. Medicine also nephrotic syndrome patient comes, and pediatrics also nephrotic syndrome patients comes. So he always used to tell me that steroid is something is very big. Okay, steroid is like, you know, it'll slow down the immune process, right? It is the anti-inflammatory, and the immune system को धीमा कर देता है, right? So starting steroids is a very big thing. It's a very big thing. So you need to rule out every single infection in my urine, get my urine routine and culture. Infection in my blood, get my CBC, LFT, even HBsAg also. Hepatitis B this antigen, hepatitis C virus, HCV also, HAV also, hepatitis A virus, hepatitis C virus, hepatitis B virus. Everything you get it done, and also get my chest X-ray, and also get my Montux also. Is Montux required? Undoubtedly yes. This is what I personally every day, I remember I was posted in nephrotic ward. There's a nephrotic ward in my hospital, and in also in Kalavati Lady Harding Medical College. So वहाँ भी हम ये करते थे करके. तो yeah, exactly. And yes, Rashmi is right. If I have congestive cardiac failure, of course you get a chest X-ray done. Very true, very true. For if you have congestive cardiac failure, of course you will get my chest X-ray done, right? To look for plethoric lung conditions, plethoric lung fields, right? Yeah, so it's over. Understood, right? Is everyone understanding? Yes or no? So you start everything, take all the investigations, ANA जो बचता है सब जो list में सब कर डालो करके. Now next is, yeah, what will urine routine reveal? Everyone knows that urine routine reveal even a 3 plus or 4 plus massive proteinuria. Now the first question is like what you called this one. Yeah, now this is very important. करते कैसे हैं? how do you do urine routine in a way, like not the investigation urine routine? Do you do any early morning, every morning, do you do any test in the child? Yes or no? Rashmi, Shagufta, Osama. Last 5 minutes, then this class is over. Part 2 tomorrow we will start at this time only. My last question is, every morning कोई टेस्ट कराते हैं क्या नेफ्रोटिक के बच्चों में? I am sharing like the real clinical scenario with you. This is what we used to do every day, okay? It is not a theory question, it's a clinical question. Every morning, do you do any test? The answer is yes. Which test? That is known as heat coagulation test. अब biochemistry पे आ जाओ. Who is the topper in biochemistry? Please raise your hand. Exactly. Heat coagulation test. Is it a qualitative test or it is a quantitative test? Who will tell me that? हाँ जी, dipstick. Yeah, देखो dip very, ओसामा ने बहुत अच्छा प्यारा बात बोला, dipstick test. What is dipstick test? Anyone? किसी ने देखा है कभी आज तक? Has anyone seen a dipstick test? Let me know. Yes or no. This is a clinical knowledge scenario. Okay, if you have not seen, I'll tell you. Dipstick test as in, and there are two options. Okay, every morning, every question number one. Every morning, what test are you expecting in if I have nephrotic syndrome? Bhaiya, every morning I will heat your urine. I will heat your urine. Why are you taking my urine sample and heating it? Because I would like to see proteins. Yes or no? I would like to see whether you have proteinuria or not. I would like to see whether in your urine protein is there or not. Right? Okay, fine. Okay, okay, take my urine, no problem. So if I take your urine, I have two options. Either I will heat your urine by heat coagulation test, which I'm gonna come in the further slides. I have a second option also. If you have good money, if you are a rich person, if you have a good money, then I will do your deep dipstick test. Doctor, I have, yeah, I have 100 rupees. I have 100 rupees. What is dipsticks, doctor? Can you do dipstick test of mine? Sounds very interesting. Dipstick test, dear. There is a dabba. There is a box basically. This box has multiple around 50-60 stripes. This box has stripes, okay, stripes. You will, the few drops of urine you will put on the one part of the stripes. Yeah, like listen to me, okay? I remember I was posted in nephrology, like in Lady Harding. I had worked in Lady Harding Medical College also, in Kalavati Sharan Hospital, amazing hospital. In Lady Harding Medical College, I was posted with one ma'am, Dr. Soumya, and she was in nephro. She was a nephro head. So what they used to do, every up 2 to 4 we had the super specialty clinics, nephro clinics. 2 to 4, every patient used to come with urine. Every patient used to come with the urine, and we had this dipstick test. We used to take out the dubbi, and we used to have lot of stripes. This stripes, lot of stripes like this. Take out the stripes and dip the dipstick. The name is dipstick. That stick. This is a stick. This is a stick. You dip it. Where to dip? In the ocean? No, in the urine. Okay, dabbi jo, that urine sample which a patient has got, no, dip the stick, known as dipstick test. You dip the stick, what will happen? Then the color will change. The color will change of the stick, it will become either very dark or either very light. So that will tell whether the patient has mild proteinuria, massive proteinuria, or what kind of proteinuria. How will the patient, how will you get to know कि कैसा है? Because like the very good answer is, outside that box, that dabba is there, no, जो डब्बी होती है, the box which is there. In that box you have lot of dipsticks, right? That box only, the outside cover of the box has a I would say color measurement, has a thing. You will take the dipstick and match with the कलर ऑफ द बॉक्स. बॉक्स में भी कुछ बना होता है, तुम्हें उसका रंग और अपने डिप स्टिक जो तुमने डाला है पेशेंट के यूरिन में, उसको कलर को मैच करना होता है. फिर वो बताता है कि नहीं नहीं, ये तो बहुत मैसिव प्रोटीन यूरिया पेशेंट आ रहा है, और यह बताता है कि नहीं नहीं, बिल्कुल माइल्ड है, कुछ नहीं करना. इतना समझ में आया है? यस और नो? इज एवरीवन अंडरस्टैंडिंग? दिस इज इंपॉर्टेंट. या दिमाग के ऊपर से चला गया? आई होप समझ में आ रहा होगा. ठीक है, दैट्स इट. Yeah, this is what we do. But remember, Osama, as Dr. Osama has told a very beautiful thing, dipstick test. But dear, dipstick is little expensive. Like India is a developing country, and even 100 rupees also for a normal government hospital patients, it's impossible. They can't afford 100 rupees. So heat coagulation test is really fair enough test. Heat coagulation test, right? Acha, heat coagulation test. Now, yeah, this was the question. So last 1 minute, then I'm gonna finish this topic tomorrow. Same time, we're gonna continue part 2. क्या कहते हैं उसको, मैं क्या कहाँ कह रहा था, हाँ, हीट कोगुलेशन टेस्ट. कैन एनीवन टेल मी, इज इट अ क्वालिटेटिव टेस्ट और इट इज अ क्वांटिटेटिव टेस्ट? हु विल टेल मी, is it a qualitative test, it is a quantitative test? What do you think? As anyone, we have so many online visitors, please put an answer. गलत होगा क्या होगा, दो बातें सुना दूंगा, थोड़ी बेइज्जती हो जाएगी, इसी बहाने जोश आ जाएगा और फिर इसी बहाने रैंक 1 आ जाएगी. हाँ, एग्जैक्टली. Yes, so it's not, it's a qualitative. It is a very good, Osama, very good. Osama, तू तो इतना अच्छा काम कर रहा है ना, आई एम सो इम्प्रेस बाय यू. पैनकेक, तुम भी अच्छे से और ढंग से पढ़ना शुरू कर दो. देखो, मतलब ओसामा was such an average student, a very 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 average student, and the way he is answering nowadays is commendable. Very good, Osama. So yeah, heat coagulation test is what you called, it's a qualitative test. Yes, that's very right. And also करते कैसे? Yeah, can anyone tell me by looking at this picture? Let's finish this question, this slide. By looking at this picture, कैसे करते हैं heat coagulation test? Doctor, you took my urine, right? In the morning time, you took my urine, right? So what are you gonna do? Number one, I will take your urine. Usually we take 5 ml of urine in a test tube, and then we heat it. ये क्या कर रहे हैं यहाँ पे? What are we doing here? We are heating it. We are heating it. Which part should we heat? What do you think? Should we heat the lower part? Should we heat the upper part? And why? Who will tell me? Every single word has an answer, dear. There's nothing to cram. कुछ भी रटने का नहीं है. मोती की तरह एक एक शब्द का मतलब है. अगर एक एक शब्द का मतलब बताएंगे तो ही अच्छे नंबर आएंगे. हाँ जी. Exactly. Shagufta is very right. We heat the ऊपर वाला part, the top part we heat. Why, ma'am? Why? No, no, I want to heat the down part. No, please. I want to heat the down part. Problem क्या down part में? Down is not, urine is not there. Huh? Why are you saying heat the upper part, Shagufta? Why I want to heat the down part? Anyone? Anyone? What do you think? Yes. Uh, Rashmi is saying, Rashmi is so funny. Rashmi is saying, we will take the 3/4 of urine and heat it away from our mouth. It's so funny. She said we will heat it but away from our mouth. पता लगा ऐसे करके heat हुआ और वो एकदम से ऐसे आता है. That's very funny. Very nice. Very thoughtful. Very mature answer. I like it. Exactly. Huh. So the answer for this one is, dear, we never heat the lower part because the lower part acts as a control. The lower part acts as a control. Matlab, देखो, you need to compare it also, right? Are you understanding? Whatever the changes will happen, if I normally we heat the upper part, this part we heat usually, and what will happen if my urine has proteins, there is a change. I will get the cloudiness, or I would say precipitates I'll get, right? So I need to compare also, right? I need to compare. एक होता है control, एक होता है test, right? So if there is a change in the color, in the cloudiness or the thickness of the urine, so I will what do you call, compare it with the control. So that is why lower half is not, we don't heat that, because the lower part of the test tube is taken as control. The lower part of the test tube is taken as control. Yeah, exactly. जूली से डोंट से सॉरी, हमारा क्लास में सब चलता है. ठीक है. रश्मि से सॉरी, नहीं नहीं, सॉरी वाली कोई बात ही नहीं यार. इट्स क्यूट, यू सेड इट, नो प्रॉब्लम. ठीक है. Exactly. So why not lower part we should heat? It is taken as control, right? That is important. So now let's finish this class. So what will happen? होगा क्या, क्या मिलेगा आपको? See, that's what now the thing is, either see, what will you get? This one, right? This one. If you heat it, if the cloudiness is present, means my urine has proteins, and if there is nothing, it's clear, then of course my urine has no proteins, right? It's very simple, right? It's very simple. And but the cloudiness basically depends. Now that question, remember we studied massive proteinuria 3 plus or 4 plus. So what is that 3 plus or 4 plus? That word is very important. Okay, so please remember, number one, if there is no cloudiness, see, remember, okay, of course, when there is no cloudiness or no coagulum or no cloudiness, means proteins are absent. Yes or no? My urine has no proteins. So no cloudiness matlab negative. Sir, urine routine test kiya, heat coagulation test, it's negative. If you see faint cloudiness, if you see some faint cloudiness, means proteins are present. और कितना protein, क्या बोलते हैं उसको? Trace. Sir, urine routine I did, sir, urine protein, sir, I did that heat coagulation test. It is trace. What is trace? So number one, when I heated the urine, sir, the upper half, there was faint cloudiness, and sir, that means the serum albumin is roughly, the urine protein is roughly less than 0.1 gram per dl. Then if you say cloudiness without granularity, cloudiness without granularity. That means the cutoff is 0.1 gram per dl. The urine protein is 0.1 gram per dl. In the beginning it was less than 0.1 gram per dl, then we have 0.1 gram per dl, then we have 0.1 to 0.2. Okay, when there is a granular cloudiness, it is +2. When there is only cloudiness without granularity, that is 1 plus. That is 1 plus. Are you understanding? ये important है dear. First was nil, then you have 1 plus, 2 plus, 3 plus and 4 plus, right? If you heat my urine and there is no cloudiness, nothing, it is nil. It is nil, right? It is nil. If the cloudiness is there but without granularity, then it is 1 plus. Okay, and if the cloudiness is there with granularity, little granules are also there, that is 2 plus. And if the precipitate are there, precipitation with clumps, basically it is formed, then it is nothing but 3 plus. And last but not the least, if it is a thick solid precipitate, it is 4 plus. It is 4 plus. Are you understanding? Yes or no? That finishes today's class. That finishes today's class. इतना ही दिमाग में घुस सकता है 1 घंटे में. उससे ज़्यादा पढ़ाऊंगा तो आसमान को छुओगे और चक्कर खाए गिर जाओगे. तो इससे ज़्यादा और नहीं पढ़ सकते. हाँ, exactly. I'll repeat this. Should I repeat the last slide? I guess everyone wants to know about it. So क्या क्या था? We have 4 plus, 3 plus, 2 plus, 1 plus and nil, or trace, I would say, right? Exactly. So Rashmi says, sir, आज से पहले I was not knowing what is 1 plus, 2 plus, 3 plus. Yes, that's right. I'm happy you did it now. Okay, exactly. So let's revise, guys. If you heat my urine sample, if you see faint cloudiness, if you see no cloudiness, matlab negative, urine routine is normal, right? If you see little faint cloudiness, that means the urine protein is trace, that is 0.1 gram per dl. Then cloudiness without granularity is 1 plus, cloudiness with granularity 2 plus, precipitation also with clumps 3 plus, and thick solid precipitate, these words are important. Okay, thick wala is 4 plus. Only if I say what you call precipitation with clumps 3 plus, thick solid precipitate is 4 plus, that you should know. And if I talk about this the cutoff in the trace, the urine protein is less than, like, you normally you see massive proteinuria, right? So urine protein less than point, in the trace it is less than 0.1 gram per dl. In 1 plus, in the 1 plus it is 0.1 gram per dl. In the 2 plus it is zero point 0.1 to zero point 0.2 gram per dl. In 3 plus 0.2 to zero point 0.4, and 4 plus more than 0.5 gram per dl. I know it's a little difficult to get it, but we should know this. That finishes today's class, and we have a lot of things to study. But tomorrow we're gonna study, like, itna kafi aaj tak samajh mein aaya? Has everyone understood? Yes or no? Please let me know. Exactly. So Ganesh says, thank you, sir. Thank you, Shagufta. Thank you, Rashmi. Thank you so much, everyone, for this wonderful participation. So now I have two things to tell you. Tomorrow evening, we have a class. Tomorrow evening, we have a 5:15 class on the Unacademy app. If you're a newcomer, please download Unacademy and type Anand Bhatia and you will find me there. Tomorrow, we have a class on the top 20 triads. Top 20 triads. The first prize is rupees 500. Students who will answer the best will have rupees 500 as the first prize tomorrow at 5:15 p.m. on the Unacademy app. And of course, at 8:30 p.m. we're gonna continue this nephrotic syndrome, basically part 2. So we're gonna continue this, right? Thank you so much, everyone, for this wonderful participation. Okay, कमली सॉन्ग सुनाओ करण कुंद्रा का. अच्छा, ऐसे फिर जूली कहेगी, अच्छा उठ के दिखाओ, अच्छा घूम के दिखाओ, सर कूद के दिखाओ, सर ऐसे मंकी की एक्टिंग, सर मंकी की एक्टिंग करना, सर ऐसे कुछ और करके दिखाओ सर, अच्छा सा. मैं क्या कहते हैं करके दिखाऊंगा बाद में, मैंने, मुझे गाना नहीं पता वाला. ओसामा कह रहा है सर आज 11 बजे, हाँ तेरा बस चले ना तो गोदी ले ले मेरे को. एक काम करते हैं, मैं लाइव बटन दबा देता हूँ, 24 घंटे हम बैठ के बातें करते हैं, क्लास करते हैं, है ना. नहीं है आज की क्लास, इंसान हूँ मैं, थक जाता हूँ मैं भी. तो आज की क्लास नहीं है बस. एंड बिफोर लीविंग माय डियर फ्रेंड्स, वी हैव दिस मोटिवेटिंग कोड. वेट, लेट मी जस्ट चेक दी मोटिवेटिंग कोड, देन वी विल फिनिश दिस क्लास. द मोटिवेटिंग कोड कहाँ है? यस, एग्जैक्टली. तो द मोटिवेटिंग कोड इज, सुनो मैंने कहा, अच्छा मुझे नहीं आता बोला डियर, मुझे वो बता देना मैसेज करके, मैं इसको लर्न कर लूँगा सॉन्ग को, देन आई टेल यू. और गिटार भी बजाना है, आई विल हैव अ गिटार सेशन ऑल्सो वन डे सून. So before leaving, we have this motivating quote which says, stepping outside of your comfort zone is uncomfortable, but it's worth taking. A very good quote. Stepping outside of your comfort zone is uncomfortable, but it's worth taking. So, this is the morale of life. Every day, take a new adventure. If I go to gym, lifting a very heavy weight, it's outside my comfort zone, but I have to do it. Why? Because it is worth taking. Because it is worth taking. This is life. I will make friends. If I make friends, will I get rejection from someone? Yes, I can get rejection. Will I get ditched by someone? Definitely, yes, I'll get ditched by someone. Will people abuse me? Yes, definitely they can abuse me. Will people, throw me away from their friend circle? Yes, I can get, I can, what you call, get abusive. I from people. I can get rejection from people. People can ditch me also. People can throw me also. But every single this part of life will make me learn a lesson. Will make me learn a lesson. And this is the purpose of life. We are here to learn lesson. We are here to learn every single day of life. So don't have this word in your mouth saying, oh God, why this happened to me only? See, my friends are so happy. Why this happened to me? I don't have friends. I don't have money. I don't have a expensive car. I don't have a very expensive laptop. I don't have a very expensive mobile. Oh, God is only doing with me. I am only the bad soul. I have seen so much of struggle. So all that drama, don't do it. मेरे सामने तो बिल्कुल भी नहीं. I hate that. If anyone, crying for attention is the worst thing you can ever do to yourself, and you can do, this is the worst thing you can do to anyone else also. Crying for love, crying for attention, crying for to be listened by people. No, if you have a spark in you, people will listen you. Yes or no? Am I saying wrong or right? That's what. So that's what, right? So stepping outside of your comfort zone is very uncomfortable. That's very, very true. But it is worth taking. It will teach you a lesson. जिंदगी भगवान की एक बहुत ही महंगी गिफ्ट है. प्लीज उसको एंजॉय करो, उसको एंजॉय करो. और रिमेंबर, जैसे कि मैं हमेशा बोलता हूँ, यू हैव नथिंग टू लूज. You have nothing to lose. If someone coming in your life, very good, come, welcome. How are you? Good, nice, very all good, all good. If someone wants to leave ASAP, evacuate, evacuate, evacuate. Make that person leave ASAP. You want to go? Please go, no problem, go. If you say, oh, no, just stay, no, why you going? I loved you so much. You are going, oh, you ditched me. All the drama, and don't do that. Be smart, be wise, be wiser, not even wise, be on that amazing level of life where कहते हैं मोक्ष प्राप्त हो जाता है. Like you have nothing to lose then. Anyone coming to you is a, कहते हैं ना, there's a very beautiful saying, right? Expect nothing, like start from scratch, and whatever comes is a surprise and a gift. Start from scratch, and whatever comes is a surprise and a gift. So expect nothing, and whatever comes, you will be so happy. I can't even tell you. My birthday was there, okay? My birthday was there on 11th March at 12 o'clock midnight. At 12 o'clock midnight, I remember only one person wished me, Osama. That's one of my junior, my one of my favorite junior. My family usually sleeps at in the night. No one wishes me in the night, they wish me in the morning. 12 o'clock, I had zero expectation. I had zero expectation that no one will wish me, and I don't want anyone's wishes. I am happy with my own soul. So I started from scratch. I expected nothing, okay? Next day, 11th March, the end of the 24 hours, end of the 24 hours, when 24 hours was almost going to an end, around 11:59 p.m. Okay, I got at least around 5,000 wishes. I got at least 5,000 wishes. Well, it took me 3 days to reply every single student. Thank you so much. God bless you. That's very sweet of you. And I had this thing in my mind that I will reply properly to every single person in a way, right? Not sending a forward, but at least typing myself, because I appreciate it, and I would like to feel that appreciation. So this is life. Expect nothing, and then whatever comes, the 5,000 positive vibes, I would say the good vibes, is a gift and a surprise. That's it. So thank you so much, everyone. And yeah, we have Javed Ahmed. Hello, Javed Ahmed. He says, hello, sir. I'm your big fan. Sir Anand, sir, please say hello to me. Hello, Javed Ahmed. Very nice to see you, bro. I am nothing without your support, and welcome here. क्लासेस को अटेंड करिए और खुश रहिए, ठीक है। सो ओके गांजा, वन ऑफ अ बेस्ट कोट, थैंक यू गांजा। बाय रश्मि, बाय ओसामा, बाय this one again Swaraj, Osama, Javed. Yeah, I'm good, thank you so much everyone. Yes, exactly. So exactly, Swaraj has a very beautiful quote. He says, if you want to buy without having a look at the price tag, if you want to buy without having a look at the price tag, then do hard work without having a look at the watch. Yeah, exactly, very beautiful, very beautiful. And I'll repeat again, if you want to buy, see, I think it's life is all about good vibes. I love good vibes, I love good quotes. I think it gives a different meaning of life. It gives a different angle and vision of living on a different scale altogether, right? That's what. So I'll repeat again very beautifully. Raswaraj Suman has told, if you want to buy without having a look at the price tag, then you must do hard work without looking at the watch. And that's very true. And then he has written, it's from your own quotes only, sir. So that's good. That's amazing. Okay, chalo, bye. Take care, everyone, and see you tomorrow. And bye, Rashmi. And exactly. So bye, everyone. Remember, bye bye. Take care. Tomorrow evening, 5:15 p.m. See you on the Unacademy app with the test, and the first prize is rupees 500. And 8:30 p.m. over here on the YouTube session again with the part 2 of the nephrotic syndrome. Bye bye. Take care. Take care. Bye 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 bye.